Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. We're here with Dr. Gomez again. Dr. Gomez, there's so much in your area. Tell us a little bit about oculoplastic. You mentioned it lightly with the cosmetic and things could happen, but you know what? We don't know anything about it.
Well, I had a patient from the United States the other day, and she was interested in doing lower eyelid surgery, cosmetic surgery, and she said, "But how do I know that my eyes are going to be okay?" And I said, it's interesting that you asked that. Well, that's why there's a specialty, a surgical specialty called oculoplastic surgery. So oculoplastic surgeons, we are eye surgeons, so we have trained in eye surgery. That is, we have completed a 4-year residency in ophthalmology, in my case in Barcelona. And then after that, we have matched for a 2-year fellowship where it's all about training in eyelid plastic surgery. So it's eyelid and facial plastic surgery, actually. So when we do any kind of cosmetic procedure around the eyes, as ophthalmologists, our first and foremost, our priority is always the health of the eye. So we don't sacrifice a cosmetic, the health of the eye for getting a better cosmetic result. And the best, I would say that our best quality as oculoplastic surgeons is that we know the anatomy and the physiology of the eye better than any other plastic surgeon that deals with the area around the eye.
I want you guys to take special attention to what he just said. One of the things that you have to, it's whether you use a service that's recommended or somebody that they're a specialist in the area that they're treating you. There's a lot of times that there's a lot of doctors out there that kind of fiddle outside their specialty a little bit. Won't say any names, but it happens. And you guys need to know that a specialist, there's a reason why they're a specialist. There's a reason why they're looking out for your best interest. Do not dabble in that area. And for this very reason, they do not know what could happen at times, and then the complications, right?
Yeah, and there's a way to know. When you go to a surgeon and you want to have specific procedure. Here in Costa Rica, there's a website of the Colegio de Médicos, so the medical doctors, this College of Medical Doctors in Costa Rica, where you could search the doctor and you can see his credentials, you can see what his specialty is, and so I think it's part of the responsibility that a patient has when he goes to see a doctor. I think it's part of, it's not, I believe honestly that patients must do their research. It's important that before they go see a doctor, they know exactly who they're going to see, at least in terms of, their training. Because, well, first of all, that will give you more confidence in a doctor, but also, it will probably guarantee a better result.
This is a website that I'm going to put inside the comments and such, so you can look up doctors if you're looking for a different specialty. But I want to talk about the Costa Rican doctor with you. Okay? Coming from the U.S., you even trained in the U.S., I want you to talk a little bit about the Costa Rican doctor, what here makes special about a certain training that I think is very valuable, that I've seen, that when you guys get out of medical school or during medical school, you have some time in the socialized healthcare system here, and that experience. Can you talk a little bit about that experience and what differentiates with your colleagues, maybe in a different country or a little bit what they call first world countries, right?
Well, so here in Costa Rica, the medical system is divided into public health and then the private sector. Anybody who goes to medical school has to undergo training under the public sector. And so that's a great advantage that we have because of the system that allows us to have such a in-depth, complete training because we get to be very close to the patient and we get to see a lot of patients with a lot of conditions, sometimes very rare conditions, because we have patients coming from all over the country to the main hospitals where the medical students train.
So it's not just theory?
No. We have practice, patient with doctor, and during an internship, which is our last year of medical school, it's not our first year of residency. That's where we really get to, we basically live in the hospitals, and we rotate through the different areas of medicine like pediatrics and OBGYN, and that's where we get our medical experience, so that when we're done with medical school, we have medical experience, actual medical experience. Once, and then after that, you can decide to stay with the public sector or do some private medicine. But I think the advantage is that if you decide to go with the private medicine, we have that training. And you can go out like I did, to different countries to get more training. But another advantage, I think, of practicing medicine in Costa Rica is also that perhaps you don't have that problem of bureaucracy that you have in other countries that slows down the process. Sometimes I feel, and I say this because I have training in Europe and the United States, that the bureaucracy, the paperwork,
forms,
exactly
the codes.
I feel like it makes doctors, perhaps in a way, so immersed in the bureaucratic side of medicine that it tends to almost inevitably have them forget the patient in a way. I mean, obviously not completely, but it does interfere. That's the word I was looking for. Interfere with your medical practice, or at least with your medical care.
So you think, as being a Costa Rican physician, that allows you to practice medicine rather than being a digital doctor?
Well, that's a great way to put it. Yes, indeed.
So, on that note, can you tell us a little bit about what differentiates you from another physician from another country, whether U.S. or Canada or even Barcelona, your experience on, because I understand a lot of it, they've done theory, and sometimes they don't see the cases. Can you talk about that, what that experience helps you in your private practice?
Well, like I said, during medical school, which I had the privilege of doing here under the public health system, that gave me a lot of experience, a lot of practice, and in terms of how close you are with each patient and with each condition, with making a diagnosis, with the whole, from the time you see the patient until the time you treat the patient, and that's the mechanism that under which we train, which is learning not just by theory, but learning by practicing under the supervision of the attendants. And so that makes medicine real. It's not something you learn, through video, or something you learn because you read on a book, but it's something you learn because you experience it. So when I was in medical school, for example, it's one thing to learn about what, a heart condition may be, and it's another thing to actually treat a patient with that heart condition, to have to choose the right diagnostic approach, to have to choose the right treatment, to have to treat the patient and see the result, than just reading about the steps in a book. And so, that gave me that experience. I think that I have the great privilege of also not just having that experience here, but also having the European experience, under the Spanish medical system in Barcelona, which was a whole different approach to medicine. And then after that, to also have the experience of the United States, how medicine is practiced in the United States. So I have, that experience of Latin America, Europe, United States, which, I've tried in my practice always to implement the best of all worlds. And so the best of my training in Costa Rica, the best of my training in Europe, the best of my training in the United States.
So what we can gather from this is that having a little bit of mesh of everything allows a physician like yourself to be prepared, to have the experience, but to have that bedside manner from 3 different continents around the world, to understand that medicine is not just one-sided, it's not just a book, it's not just theory, but there's also a human side. I think that's one of the things that distinguishes a lot of physicians in Costa Rica.
One of the things that I really enjoy is to be able to, I have the ability to approach a patient that comes from the United States in a different way from a patient that I see from Costa Rica, from a patient that comes from France. And I know how to approach that patient. I know what that patient is looking for, and I know how to establish a relationship. It's completely different having a patient coming from the United States and having a patient that's coming here from Costa Rica. So I really enjoy having that capacity to
Connect.
To connect with my patients regardless of where they're coming from.
Well, Doc, I think that we had a lot of information. You know what? If you're choosing a doctor and you want a doctor that's well-rounded and even just an opinion, I think this is a physician that will give you that, but also give you a little bit more. I hope this information was good for you. Take care and pura vida.
Thank you.